Public Health fam, have you ever left a meeting feeling unaccomplished? You know the type, the one that goes round and round in circles, the conversations seem to keep going but never end, and you leave and you're really not sure what the next steps are? You know the type. Well, you know what? You're not alone. Today, we're going to take that frustration and turn it into facilitation success, and I'm going to show you how. Let me tell you a little story that might sound familiar. In public health, we are natural connectors and communicators. Those are our superpowers. But sometimes this strength can become a weakness in meetings. I used to attend these meetings where we would spend 30 minutes just on round robin introductions, let alone on Zoom, where no one knew who had to go next. We would spend so much time talking about our weekend, our favorite coffee order, but we would never really get to the good stuff. While this built great relationships, our agenda often got pushed to the side and on to the next meeting. The breaking point came when we got to a crucial community health initiative meeting. We had 20 people there. We spent 45 minutes on catching up and introductions, and then we had to rush through important decision-making and project implementation. That's when I realized we needed a structure to channel our relationship-building energy into a more effective meeting. So I volunteered to facilitate the next one. I created a simple agenda, set time limits for each section, and I even left a few minutes in there for chitter chatter. I know my people. And suddenly, everything changed. We actually ended the meeting on time and had actionable steps to move forward with. Can you imagine that? And the beauty was we still maintained a very collaborative, connected culture. And that is when I fell in love with the power of facilitation. All right, so I'm going to show you how I do it. We start with the meeting preparation framework. We'll start with the foundation, preparation. Think of it like preparing for a community health fair. You wouldn't just show up and wing it, right? Here's your pre-meeting checklist. First, tech check. Test everything 10 minutes before. Trust me, nothing derails a meeting like technical difficulties during emergency response coordination. Room setup. Whether virtual or in person, create an environment that supports participation. Time buffer planning, so important. Add 5 minutes of buffer for every 30 minutes scheduled. During a recent meeting, we had stakeholders from everywhere, hospitals, community-based organizations, the health department present. By doing tech check early, we actually identified some issues and were able to resolve them, saving precious coordination time. Next, energy management tools. Now, let's talk about energy, because public health meetings can get heavy, especially when discussing challenging community issues. Here are your go-to tools. Energy check. Start with a quick 1 to 10 energy level check. It takes 30 seconds, but gives you valuable information about how to pace your meeting. Movement breaks. For longer meetings, incorporate stand and share moments. Quick fixes. These are your rescue tools when energy dips. You can reference these quick fixes in the guide. During a 3-hour health equity workshop, we used the 2-minute quick stretch break technique. When energy dropped under 5 out of 10, it worked miracles. Participation increased dramatically. Next, you'll want to consider practical facilitation techniques. Let's get into the techniques that will transform your meeting. The Moscow method for prioritization. Must have, should have, could have, won't have right now. We use this during a community health needs assessment meeting. Instead of getting overwhelmed by 20 possible initiatives, we were quickly able to identify 3 priorities. The parking lot method. Keep a visible space for off-topic but important ideas. Review these items in the last 5 minutes, and then assign owners for follow-up. Let's talk through a real scenario. Imagine you are running a community health worker training program meeting, and you guys need to decide on the training topics for the next quarter. Here's how you apply these tools. Pre-meeting, send out a topic suggestions form. First 5 minutes, quick energy check and meeting goals. In the middle, use the Moscow prioritization for topics. And in the end, have clear action items and assigned owners. Remember, every public health meeting is an opportunity to improve community well-being. These facilitation skills, they don't just make meetings better. They also help us serve our communities more effectively. So here's your challenge for this week. Pick one technique from today's episode and try it in your next meeting. Maybe it's the energy check or the parking lot method. Start small, but start somewhere. Share your experiences in the comments. I would love to hear how these techniques are working for you. And don't forget to download our joy-filled meeting facilitation guide in the description. Until next time, keep making public health meetings joy-filled and effective. See you next time.